Even if COVID-19 is unavoidable, delaying infections can flatten the peak number of illnesses to within hospital capacity and significantly reduce deaths. Everybody I talk to about this in my area is in the whatever camp, which infuriates me. Yeah, whatever if you get it, but what about when you visit your parents/grandparents/cowhawkers, then they get infected and it spreads further. To me, it is how disposably we seem to be treating our elderly. This virus is eating a nursing home in Wa. Does no one literally care about their parents and grandparents? I have a father in a nursing home with breathing issues. This virus will kill him. He isn't disposable. I have to say that everyone in my office says whatever, but then they mention how their hands are irritated from constant hand sanitizer, or I hear them disinfecting their whole cubicle. I think more people don't want to be perceived as the person that is freaking out than are really not taking it seriously. Pretty much everyone alive today has the luxury of never having had to deal with a situation like this. We are conditioned to think this is fine. It won't happen to me, because we are used to being fine, and we are used to bullshit scare stories. A lot of people I know are still stuck in this mindset. When I talk about the facts and trajectory of this thing, I'm called paranoid. I'm not a paranoid person. I have many faults, but I pride myself on staying calm and scrutinizing the information I come across. You don't have to extrapolate very far to realize that this shit is heading right to the fan. I'm young and healthy, I'll almost certainly be fine. But I have 4 grandparents in their 80s who are all exceptionally high risk. I have 2 parents in their 60s who are healthy, but also statistically close for comfort. It is vital that we remain calm, but also take this seriously. We succeed when we think about society as a whole. We are all safer if we work as a team. It's going to get a little ugly, but my one takeaway is that a lot of countries right now could do with something to remind us of what unites us, something to pull us together instead of apart. I hope it goes that direction, because if it goes every man for himself, we see probably a lot more fucked. These idiots think they are being woke or tough by not taking the virus seriously. They seriously are just as dangerously ignorant as global warming deniers. I talked to a receptionist at my dentist's today, and I said, in an attempt to be sympathetic to their staying open, I hope people are at least cancelling their appointments if they are showing symptoms. She said, oh no, the city can't just close down every time there's a cold. We clean all the time. We are probably the safest place to be. I was flabbergasted. Yeah, they clean all the time, but they spend the rest of the time zoomed in on people's faces with their hands in their mouths. People who are often spraying spittle or drooling around machinery that makes that spittle fly everywhere. Coronavirus is a primarily droplet transmission. You know who else cleans all the time and wears masks? Healthcare workers. The same healthcare workers who are exposed to a heavy viral load and are getting sick. I can see where she's coming from, but damn. It's much safer to be at home than it is leaning over sick people with their mouths propped open. People keep comparing this to the annual deaths of the flu, but forget important details. This virus does not have a vaccine yet and won't be available anytime soon. The human race has also been building up immunity to various types of flus for thousands of years. This coronavirus is whole new animal. So is this just life now? We prioritize social distances, work from home, cancel all major events, meaning all sports and music are over forever, stop seeing our elderly relatives, stop having any relationships/kids, because intimacy/sex requires physical contact, and just wait to die. My whole office is blaming the media for this, and that Trump is under attack for it. The end. No one is doing any preventative measures. We fucked with an iron mace. Edit. Due to a series of persuasion and things occurring, the whole office is now remote, a feat no one imagined can be viable before. We are lucky to have gotten a paycheck as AM during a time where so many folks are lost. People are going to get it, but if you can avoid it being all at once, it helps tremendously. This is awesome to help explain to children and teens, especially. Thank you. Lol, not just children and teens, but also stubborn know-it-all adults. Funny part is that they, stubborn older people, are the ones most at risk. Most quarantine plans have provisions in place for the basic needs, food and water. Most likely it would be that lorry drivers can get an exemption to deliver foodstuffs to an area, and then volunteers within the quarantined area pick it up from the drop zone and distribute. Sort of like you and your friend, but a lorry instead of a carrier bag and a warehouse/container/car park instead of a doorstep. I wasn't feeling too hot today. I have this weird dry cough, a little sluggish, but otherwise feel fine. I work in it as a cloud engineer, so I asked my boss if I could telework today. The response was I can use a sick day or come to work. It's probably nothing. I'm not worried about myself, I just don't want to spread anything. I stayed home today, but I guess I will be in tomorrow. My boss doesn't take it serious, nor do many people. So I'm just resigned to it at this point. I have a feeling this is going to be common. Oh, you're sick. Doesn't matter, we need you anyway. Get your ass in here. Good old American capitalism. I work for a big corp and we have a pandemic task force and we are taking it seriously. If we feel sick or have traveled outside country, we have to work from home. My company's viewpoint is that our people bring the value to our shareholders. So if we are sick and make more people sick, the value we bring in is impacted. I think that's a good way of thinking about it in a capitalistic viewpoint. I highly doubt that. Coronavirus is 20 times more deadly than the flu, but that's still only a 2% fatality rate. Based on my terrible math and less than rudimentary understanding of this, for 50,000 to die a day from COVID-19, 2,500 would have to die from the flu. Now I understand coronavirus likely will have more infections. Didn't read the source yet, but you have to consider that there have only been 16,000 deaths from the flu this entire year, as opposed to my prediction of 900,000 deaths a year. So unless coronavirus is the most lethal virus, or is 57x more infectious than the flu, I don't see how the numbers are off that much. They're expecting 40-80% of the population to contract the virus. You have to also factor in that the flu typically dies out in warmer weather and is only common in the winter months. It would not average the same amount of deaths every day of the year. COVID-19 is not limited by the typical flu season. If you're looking at 250 plus million people with the virus, then that 1.5-3% mortality rate looks a lot worse. You're looking at millions of deaths. The flu doesn't even come close in comparison. Every time someone tells me it's not dangerous for my age range, I ask them what happens when all of the ICU beds are taken and you get in a car accident. The surgeons will thank you for giving them something to do which they know how to manage. They won't want to be doing coronavirus related work. Operating theaters won't be full. They'll probably all be empty as planned surgery will be cancelled. They like caring for surgically unwell patients and they'd make space for someone unwell like that, unless we are talking disaster scenario. China woke up and took drastic steps. Since then, the amount of new cases is dropping drastically and the current cases are plateauing. These measures need to be taken by most countries at high risk. I think the US is going to do something similar. The US absolutely has the system and resources to react very effectively to this outbreak, but is so slow to action. Things are going to hit a breaking point, and then we'll get our shit together. Not ideal, of course, but better late than never at this point. The disease isn't even inevitable. China and Korea have shown that the disease can be managed if everyone is taking it seriously. China was also rounding potential viral carriers off of the street and straight into metal boxes in the back of pickup trucks to forcefully quarantine them. They kept detailed logs of every citizen that left Wuhan, hunted them down, quarantined their new house, and informed the entire neighborhood that that individual was in the infected area, and encouraged them to socially shame them into quarantine, and inform the government if they tried to break out. Their personal details were leaked online as a further method of social shaming. Our response has been bad. The government has missed the chance where it can save us with low economic impact. We can still save ourselves though. The math for disease spread implies that whether your amount of infected grows or decreases doesn't depend on population size. If non-quarantined sections of China can take the number of infected from 1,000 to 700, then we can decrease the number of infected, even if we had 100,000. Obviously, this is assuming our behavior doesn't change based on number of infected. We had many opportunities where we could have done that, but no one was willing to take it seriously enough either, because they didn't really think it was going to be a threat, or they just didn't want to admit it was a problem because it would affect their income. The only way we can have a chance of stopping at this point is if we just shut down the world for maybe 3 months and had everyone quarantined in their homes to stop any infected from walking around and to give those infected time to heal.